Hi, this is Dr. Brittany Millender presenting a shared project for QuESST 2022 entitled Effect of Complications on Urology Trainees, an Epidemiological Survey. It was created by Drs. William DuComb and myself with research advisors Dr. Christina Susan and Dr. Joshua Palka. It was based out of the Department of Urology at the Detroit Medical Center. Unfortunately, surgical complications are a quite challenging part of residency and fellowship training. A great part of their surgical training focuses on diagnosis and operative skills. However, to date, there's little formal education provided to trainees on how to cope with surgical complications. This project was aimed to determine how both residents and fellows in urology cope with complications. To perform this project, an IRB approval was obtained, an electronic survey of 15 questions regarding surgical complications was created. This survey was then distributed to all ACGME accredited urology programs via email, and it targeted residents and fellows. A descriptive analysis was performed. There were 107 residents and fellows who responded. The great majority of responders were senior level residents, either between PGY levels 4 through 6, and they comprised 58.5% of the responses. The remaining distribution of the survey responders are shown in Figure 1, but again, it included all levels, including fellows. The average age of responders was 31 years old. As displayed in Figure 2, there were a variety of different methods that residency trainees and fellows reported that they used to cope with their surgical complications. The highest reported way to cope was discussion among peers at 97.2%. Many trainees, a reported 83%, also discussed the case with faculty. While there were positive ways to respond to the complications, such as exercise, with a reported 38.3% of trainees, there were also negative ways, and 27.1% of trainees reported using alcohol to cope. Again, these are all distributed in Figure 2. Other methods include discussion with the spouse, discussion in morbidity and mortality conferences, and also discussions with family or friends. However, there were also negative effects of these complications. Trainees reported that the complications caused performance anxiety. 70% of people reported this. 76% reported that the complications cause a loss of confidence, and 75% reported that complications cause excessive thoughts regarding the complication. Additionally, the complications also cause negative emotions. As shown in Figure 3, 71.2% reported experiencing feelings of anxiety or fear. 67.3% reported experiencing feelings of sadness, grief, or depression. And 51% reported feelings of being overwhelmed, helpless, or hopeless. Additionally, 43.4% reported that the complications cause lack of sleep. Furthermore, nearly 37% of the trainees felt that they were unsure or not prepared to handle complications upon graduation. This was displayed in Figure 4. Complications, unfortunately, are an inevitable part of urology residency training for and fellowship. However, these complications may cause psychologic consequences. As shown in our Figure 3, Figure 4, trainees often feel unsure and unprepared for managing complications upon graduation. While research has identified how attendings cope with surgical complications, further research should investigate how trainees cope with complications and how didactics can prepare trainees to handle these complications upon graduation. Thank you for your time.